So when you see a SATA question, you have to go through these steps. Step back, close your eyes, and go through these steps. Look into the question and see what is being asked. And you can find that in the last portion of the question. So you find it at the last portion of the question, and that is what is going to give you a clue of what is being asked. So that is the asked portion of it. Then you ask yourself, what is the medical scenario? And that is where you read the rest of the question. After you read the last portion of the question, read the medical scenario, and that is your case. So your case is now going to give you an idea, the scenario. Where am I? Am I in the emergency room? Am I in the hospital? Am I in the clinic? Am I in the OB clinic? And you put yourself in that situation because that synthesizes the information for you. Then find 3 to 4 keywords. Not every word is a keyword. I call that buzzwords. So you find the buzzwords in the question, just 3 to 4. Even 3 is sometimes enough. If you're getting more than 4, it's confusing yourself. You don't know what is being asked. You are not focusing on the main information the examiner wants you to know. Then take control of the question with those 3 to 4 words. Rewrite them. The 3 to 4 words, write them in the sentence, but don't put too much words in it. Then evaluate each answer using the rewrite independently. Every question is different. Every answer choice should be evaluated independently. So assume if they give you 6 options, tell yourself, I only have 1 option for that question. So my chance of answering right is 50-50. I'll forget about the other 6 or 5 choices. So you evaluate each question independently, and that is your choice. And after you make that choice, don't compare the answers, and therefore you move on. So what is being asked? That's the thing. Anticipate the findings. So an expected finding. We're looking for expected finding based on that. Then the next one is the case. What is the case? A client admitted for cirrhosis of the liver. So the case is cirrhosis, right? Then what is the buzzwords? The buzzwords is you can take the liver and then use the anticipated, which we already use it as our ask. So we have a liver cirrhosis anticipated finding. Those are my buzzwords. Then I rewrite it in the simple form. Somebody with the cirrhosis of the liver, what do I expect? That's all. And then I make my choice. I make my choice based on that. I'm looking for expected finding, cirrhosis of the liver. 3 things. Each answer choice should satisfy this, at least. So you look and they give you what? Hypernatremia, that means sodium is high. Does that satisfy cirrhosis of the liver on the patient? No, when you have a liver cirrhosis, you develop ascites and you are fluid overloaded because of the congestion. And your body think that even your sodium is low, systematically, they think you're dry. So you hold on to water. So that's why you develop ascites. So your sodium is low. Therefore, I take this out. Hyperbilirubinemia. Well, I told you what the liver does. Involve it bile, fat metabolism. If you're in congested, well, your liver cannot break down bile anymore. So the bile build up. So that's why you have hyperbilirubinemia. So this is right. Hyperalbuminemia, basically increase albumin. If the liver is affected, you can't make your protein. So albumin go down. So it's hypo. Elevated INR. Liver make clotting factors. If I don't make those clotting factors, my INR, that means your blood will be thin. So it goes up. So this is right. Thrombocytosis, that means you have high platelet. In liver problem, you develop portal hypertension. and that causes a splenomegaly, and your platelet goes down. Therefore, you don't get cytosis. You get thrombocytopenia. Elevated ammonia. The liver detoxify chemicals. Ammonia is broken down. Therefore, if you don't have, if your liver is affected, your ammonia level goes up. And leukocytosis, there's nothing related to that. Leukocytosis has nothing to do with our keywords. This is how they can trick you. It's expected cirrhosis of the liver. Having cirrhosis of the liver, does that make your white count to go up? No, unless you have infection or infection of your ascites. Therefore, this is a question you have to evaluate. You evaluate it based on your buzzwords. Okay, you rewrite it and you create it, and you see, I make a decision and I keep on going forward. So this is wrong. And I did not go back. I just checked my answers and I'm good. This is how you tackle these kind of questions. Same question. Let's look at another one. Another SATA question. And next, so what do we do? The first thing is we look for our asked. Our asked is the last portion of the question. Unfortunately, this is a long day. You can see something like that, yeah. And then you have to break it down. Because there's no last portion of the question, you still will look at it as the lower portion. You read it, all the question, and find the last portion of it. And next, we'll implement which nursing teaching at discharge when caring for a client diagnosed with the cirrhosis of the liver. What is being asked? Implement. So I need to implement something. Implementation. So I'm looking for implementation answer. Anything that doesn't show implementation, I'm not picking it. So implementation. So I write it down. That's my, we've read the ask and the case all together. So I'm writing my buzzwords. So implementation, because we know that a nurse will implement which nursing teaching at discharge. So that means we are in the hospital. We've looked at a case and we have known what is being asked for a client diagnosed with cirrhosis of the liver. So implementation of teaching, that's my buzzwords. Okay, teaching. When caring for a client diagnosed with what? Cirrhosis of the liver. So cirrhosis. So implement teaching of cirrhosis. That's all. Those are your buzzwords. You rewrite it. I'm going to teach a patient who has cirrhosis of the liver. And so I'm implementing this teaching that is necessary when I'm discharging him. That's all. All these long sentences doesn't matter. Rewrite it in your head. And then you make a choice. You know the basics of the liver. Okay, you know your content. This is why the pathophysiology come in. So I'm going to use my content. Take Motrin for leg pain. Yes, I don't want to take any medication that will affect the liver. Okay. And the medication that affect the liver is like Tylenol, acetaminophen, which mostly when you have pain. So Motrin, taking Motrin is okay. Take adequate rest. Yes, when they have cirrhosis of the liver, they develop ascites, their belly is big, they have congestion, they can have pulmonary issues, and because of the side is pushing on the diaphragm. So when they walk, they get tired. So they take rest. Avoid all protein in their diet. This is the problem. You know, the liver, it manufactures some proteins, but liver is affected. People think you don't have to eat too much protein because the liver cannot use the protein. No, you shouldn't stop all protein. You should minimize it, but don't stop. Avoid all protein. Take adequate amount that you usually take. So take adequate amount. So don't stop it. Then, so this is a key word there. All protein. Occasional alcohol is acceptable, where I'm implementing teaching and cirrhosis and no cirrhosis of the liver. I need to avoid some toxins. Alcohol is a toxin for the liver. Therefore, it doesn't jive with these three information. So Occasional is not good. They're tricking you. You should avoid all alcohol. Low carbohydrate and high fat diet. I know that I need bile to make and break it down. But the bile cannot go into the system because it's getting congested. The liver is very congested. The bilirubin is coming from red blood cells. Okay, and the liver is going to break it down. Okay, this is red blood cell hemoglobin. That's the product of that. So the liver try to lower it. If I cannot get this into the system because the liver is not working well, I shouldn't take too much fatty food, okay? But I should take a lot of high carbohydrates. So high carbohydrates, low fat diet is what is recommended because the fat is in your system, the GI tract, and the bilirubin now cannot go into the bile cannot go into the system. It's all backed up. So that's why the bilirubin is high. So you should decrease the amount of fatty food in your diet. May need to adjust TB medication. Guess what? All the TB medication causes liver injury. INH, rifampin, streptomycin, and ethambutol. If you're taking any of this, you need to adjust your liver. You need to adjust the level because if you have cirrhosis of the liver, you have a video that talk about all these medications. You can check it out on my website. But so they should not take this. They should adjust the TB medication. So this is acceptable. So I've used it to use the ask case buzzwords, rewrite choice, and then we move on. All this is based on your content. Number 3, same scenario, right? Same scenario. So what is our ask? We got to go for our ask. Which of the following the nurse will implement in the care? So that's my ask. Okay, we got to implement, right? What is the case scenario? Which situation we are in? The client was admitted to the hospital, right, with cirrhosis. The client became confused and diagnosed with hepatic encephalopathy. Which of the following the nurse will implement? So we know the situation. We know we have to implement something that's being asked. We know the case, patient is in the hospital with cirrhosis. Now he have encephalopathy. What are my buzzwords? I have cirrhosis, okay, of the liver. He became confused and then diagnosed with encephalopathy. That's all. So I'm going to implement something on the patient who has cirrhosis and has developed encephalopathy. That is my rewrite. 3 words. I'm not going to write all this, very short. I'm implementing something on a patient who has cirrhosis that has developed encephalopathy. Those are the buzzwords, and I've used it to rewrite it. So encephalopathy, cirrhosis, and implement. And therefore, we evaluating each answer choice with that, right? You know what the encephalopathy means. Means you have to use your content a little bit. Ammonia level is too high, and therefore patient become confused, and they have other specific symptoms, and they go into encephalopathy, basically brain dysfunction, and they can go into coma. So I'm looking at each answer to meet all these choices. Evaluate of flapping tremor with hand stretched. This is another way of saying asterixis, and that is true. That's patient has asterixis. So you look for them if when they stretch their hand is flapping tremor. That's asterixis. So that is true. I will pick that answer as my choice. So asterixis. So I will implement this to evaluate for that. You tell me whether the encephalopathy is still going on. Tylenol for pain. Yeah, somebody with encephalopathy, I just want to let the liver resolved. So I see Tylenol, I look at my answer choice. How would this fit in? Well, it will fit in cirrhosis. I should take Tylenol instead of, no, I shouldn't take Tylenol instead of Motrin. If I take Tylenol, my liver get into trouble and you develop more encephalopathy. So no Tylenol. Lactulose enema. Does it meet any of the implement, cirrhosis, encephalopathy? Yeah, I see encephalopathy treatment is lactulose. And therefore, you can give lactulose in the form of oral form, okay, in enema form. And so those are the extra form, and then in the two forms. So they can take it by mouth or as an enema. So we give them to them. Hold lactulose if more than 3 bar movement is ensured. Yes, you don't just give them lactulose. Lactulose is a laxative, okay? And when you take in, it doesn't digest until you get to the GI tract itself, the colon, where it help with the decreasing the ammonia. It pull water into the system, into the GI tract, and it will give you diarrhea. And so you have a lot of bowel movement, and the patient can get dehydrated. And therefore, you have to titrate the number of bowel movement to lactulose. So the therapeutic effect, this is content of lactulose, is 2 to 3 bar movement. Anything above 3, you got to stop it. Otherwise, they will be dehydrated. And it pull electrolytes, certain electrolytes into the system. When you have diarrhea, your potassium is low. So that is why this is very important. So they get dehydration and hypokalemia. This is content you have to know. Therefore, more than 3 bar movement, yes, I should hold it because I've achieved my therapeutic value. If I go more than that, that will be a problem. So I should hold it. We should implement it. So that's right. Check potassium level. I told you they get dehydrated, they have diarrhea, and lactulose can decrease your potassium. So you should check your potassium. Give lactulose by mouth with food. Lactulose, this is content, need to be taken either without any food. So you should take it empty stomach, okay? But there's a caveat. There's certain things you can take it with. It doesn't taste good. Only thing you can take is milk and fruit juice because of the acid. Therefore, the only thing you can take with lactulose is milk and fruit juice. Don't take it with food. So this is wrong. And then we've answered our question. You see, lactulose meat encephalopathy. Potassium meat encephalopathy because we got to use lactulose. All this answer choice, it meet our buzzwords as we define it. So those are the keys to answering SATA question. And this is the last question. Same thing, we're going to break it down in the same way. So what is being asked? Which of the following assessment finding should the nurse expect and implement? So I'm being looked for assessment, okay, assessment finding, okay? So that's being asked me. And then I go for the case. A nurse is caring for a client with known diagnosis of cirrhosis due to a B with severe jaundice. Okay, that is the scenario. So patient is in the hospital, he has cirrhosis due to hepatitis B, and he has severe jaundice, a bunch of words. What is the case? We've shown the case. In the hospital with that, and they ask, we know, I want to find assessment finding that I should expect and implement. What are my buzzwords? Well, expected finding, and I need to implement or implementation, somebody with cirrhosis, that's all, with jaundice. So this is almost 3 to 5 words, so close to 4. So expected finding, implement, somebody with cirrhosis, and jaundice. Those are my four words. Expected finding, that I need to implement, and then cirrhosis and jaundice. You see, all you care about these words. Don't forget about the question over there. Hepatitis B infection, I don't care about it. I care about expected finding, implement, cirrhosis, and jaundice. Therefore, let me evaluate. Clay College 2. How does it relate to these 4 words? I see jaundice may be a clue. If you have jaundice, you have asterixis, you're under your tongue, you see, and your skin is yellow, and your stool, your urine, your stool become clay colored instead of a normal brown. Therefore, this is fine. Tea colored urine. Instead of your urine being the normal color, it become tea colored because of it's not concentrated, it's sign of jaundice. Jaundice. Supply cotton gloves for the client. Why? Why am I doing that? Look at your buzzwords and your rewrite. Expected finding, implement, cirrhosis, and jaundice. If you have jaundice, you get pruritus, that is itchiness. Your skin is going to itch nonstop. And so these patients scratch their skin and they break their skin. They scratch until they feel much better. And it's a vicious cycle when you scratch because of the high bilirubin. If you give them gloves, when they scratch the gloves, they don't break their skin that much. They may scratch, they get a benefit, but the skin doesn't break. If the skin breaks, they get infection. They have liver disease. The infection is really bad. They didn't heal well. Therefore, give them gloves to do that. Encourage warm bath twice a day. Well, when you have pruritus, your skin is usually, when you scratch it, you get dry, okay? And therefore, if you take warm bath, it will cool the skin and that will prevent them from scratching. Avoid trimming their fingernails. Well, that is bad. It's all jaundice. If the fingernail is long, when you scratch, they break their skin and they have infection. So therefore, we cancel this. Paracentesis. Does that relate to this? Yes. Expected implement cirrhosis jaundice. But what is the question is asking you? Severe jaundice. This is a distractor. The whole thing is severe jaundice. Even though it has cirrhosis, it's asking you for severe jaundice. Severe jaundice. Don't let this distract you. There's nothing in here that say patient has ascites. If I put ascites here, yes, paracentesis. But this, even though there's cirrhosis there, the asked portion of all the question, I mean, the main thing we implementing is relationship to what? Severe jaundice. Therefore, I don't do this. Don't let that distract you. So this is wrong.